Good afternoon, guys. I hope we're all sparkly. I think it's safe to say that getting TRT in the UK through the NHS can be a bit of a challenge. You walk into the doctor's office with a beard, he goes, "Whoa, that's impressive. You can't have low testosterone." You walk with muscles, he goes, "Look at those guns. There's no way your levels are low." He looks at your records and sees that you've fathered a child. Well, things are clearly working down there. Shock horror. Disappointing, tragic. Your doctor often judges a book by its cover, which is shocking, really. We're going to talk about a guy, 30 years old. He presented to the doctor with symptoms of mental discord. He'd actually been under active review since his mid-teens. Eventually, they agreed to test his testosterone level. It came back low. He was referred to the NHS endocrinologist and prescribed TRT. This is a result, obviously. What was he prescribed? He was prescribed 250 milligrams of Sustanon every 4 weeks. Funnily enough, he did not feel very good on this protocol. Having an understanding of pharmacokinetics and pharmacodynamics, you will realize that this is an ineffective TRT protocol, and you will have peaks and troughs, not only from the 4 different esters, but the fact that the injection interval is too wide. So, reassuringly, his doctor reduced the injection frequency to every 3 weeks. Disappointingly, his trough levels were lower than his pre-TRT levels. Still. So, it doesn't take a rocket scientist to work out that this is ineffective. If the premise behind TRT is to achieve stable male androgen levels every single day, if you're thinking about a crazy substance such as Sustanon and an injection frequency of every 3 weeks, if you look at the curves of the 4 different esters, you can see that it's not going to be effective in achieving stable male androgen levels. So this guy was struggling. He was reaching out to the TRT in the UK Facebook group that we run and desperate for help. He didn't have any money, so we agreed to see him for free, under the agreement that all further consultations and costs of medications would obviously be at his own expense. But I wanted to get him on the right path. What we do is we write to the GP and we ask them to see if they will kindly monitor the bloods and sometimes prescribe the testosterone. So it stands to reason that with a confirmed diagnosis of testosterone deficiency and TRT prescribed through the NHS, his GP would be amenable to having at least his bloods done through the NHS, plus or minus the testosterone. But that's not quite so clear cut, because obviously the equivalent to cypionate is an anthate, and that's actually quite expensive compared to cheapest chips Sustanon. But we saw him, we got him dialed in on testosterone, cypionate and HCG. His GP took over monitoring his bloods, and he was happy. He saw both a physical and psychological improvement in his overall health, and he was taking positive strides in addressing the other aspects of his life that he needed to address. Lifestyle, diet, exercise. How many times do I have to say it? I was really pleased to hear that he actually enrolled on a new university course. Something that he'd been wanting to do, but not had the courage and conviction, confidence and self-esteem to do pre-TRT. Wonderful. At university, he had to register with another GP. And lo and behold, we received an email the other day. He was thrilled. Not only were they going to monitor his bloods, they were going to prescribe him testosterone, enanthate and HCG. Wonderful. So that's a significant load off of his mind, because obviously TMHC is a private clinic and it does cost. However, we are happy to support you guys as long as obviously the GP stroke endocrinologist is happy as well. He was overjoyed, so he just emailed us literally to say thank you for all of your help. So I said, testimonial time. Disappointingly, a couple of days ago, we received another email, this time from the GP, who said that they can no longer support this patient in anything. Not just the prescribing of the drugs, which admittedly does cost, but the monitoring bloods that would have had to been monitored should he been on TRT through the NHS. Now, isn't this absolutely scandalous? A guy with confirmed testosterone deficiency, TRT commenced through the NHS, the patient decided to go private for a better standard of care and service. This would undoubtedly save the NHS money because the TRT is actually paid for by himself. Initially agreeing to do bloods, then agreeing to do bloods and prescribe the medication, to then a complete U-turn and saying, no, we won't support you. This guy has a confirmed deficiency. Why won't they support him? Because he's gone private. So that means that the NHS are going to waive all responsibility. They no longer have a duty of care to you because you've gone private. The fact that this guy is saving the NHS money by not having the TRT prescribed through the NHS is by the by. You've gone private. Screw you. Isn't that absolutely scandalous? Disappointingly, this is not a one-off occurrence. I've heard numerous stories about this over the last 7 years. It is scary, the mismatch in private versus NHS and the attitude that a lot of doctors have towards not only testosterone deficiency and TRT, but private care. So if you're not burdening the NHS, surely this is a positive thing, not a negative thing that you should be able to wash your hands of. So I'm absolutely horrified, but to be fair, I'm not shocked because it is what it is. Now, the NHS's attitude towards testosterone deficiency isn't a good one because of the associations with, you know, the bros. It is what it is. So what you have to do is take your own health into your own hands and take personal responsibility. Disappointing, but it's fact. We are never going to change attitudes. What we need to do is concentrate on self in order to change others, but it's going to take time. Don't wait, act. Be proactive, not reactive. And do what? Earn your reward.